I did do that.
Yeah, then we'll just leave it.
Yeah, you should.
You're already here. You're already here.
Yeah.
You're already here. You're not getting paid to be here for this.
Oh, right.
We might keep going, guys. So thanks for coming along today. My name's Sheree and I'm a dietitian based at Community Health just across the road. So today we'll be talking about malnutrition screening, and I've given you some handouts that we'll be referring to today. So basically the malnutrition screening tool is what I'll be talking about, and the goal of today is that you should be able to fill out the malnutrition screening tool using clear and focused language when you're questioning the patient, and be able to record the results on the form accurately. Does that sound alright?
Sounds good.
And I'm planning on only taking 20 minutes to do this session today. So it's going to be quick and easy.
Why we like them.
Exactly. So with our residents in aged care, they're required to be screened for malnutrition on a monthly basis. But have any of you used this malnutrition screening tool before? Yeah. So I've given you that form, which is the, I guess, the required form that we can use, and that's got the malnutrition screening tool on there and the spaces where you can record the responses. So that might be something that you could keep in the patient's file and just fill out on a monthly basis. I think it's something, do you guys have like a resident of the day or something like that? That could be a good time to do it.
That's when they are.
Walk straight in front of the video. Give us my things and Patty can sit there if she likes.
So for those that have used the malnutrition screening tool before,
Oh, you meant to do it.
how did you find it? Any comments about it?
I mean, it's basically
it's on its
just
way.
to gauge whether they're gaining or they're losing, and then what the action is. And that's why it's important for the girls who have their different patients to actually weigh their patients every month.
Yeah,
so we can
that's
then
right.
transfer it onto this.
Exactly. So I guess the first thing is that because we're doing this malnutrition screening, we need to be weighing the patients on a monthly basis as well, because that forms a part of the screening tool. So I haven't planned any breaks in this session, so because it's only a 20-minute session,
That's
so
okay,
we should be finished pretty quick.
We can't stop for a cuppa.
And if for some reason we needed to do an emergency evacuation, we can just go straight out there, straight out to the exit.
Is this for me?
So
Yeah.
I'll be demonstrating
Can you
how
hold mine
to
down,
use the
please?
malnutrition
What's your name
screening tool, and then you can
Oh,
ask me
two,
some
my
questions about
Oh, okay.
if you had any questions about how I demonstrated it,
Changed.
and then you'll have a chance to practice using it yourself.
Don't be rude.
Oh, you were rude.
And then we'll just see how we went with
What's your
practicing
name,
using it. So, we'll go through this handout. I think this one's a good one that explains.
Can we go get a copy, John?
Yep.
Patty and do it on like that.
Okay.
Thank you.
You guys ready though? Can you read that number?
Oh, thank you.
Yep. Transfer.
Thanks.
Can you read that number, D?
239.
So this malnutrition screening tool is just 2 questions. That's how quick and easy it is. The first question is, has the patient lost weight
Oh, I
recently?
can't fit it
Which
in.
you could check in the patient's record without having to ask them, and you can fill out that section without having asked the patient. But if you're not sure, you could always ask the patient themselves, and they might be able to gauge whether they've lost weight or not, depending on the patient. And the second question is, have you been eating poorly because of a decreased appetite? So they're 2 pretty basic questions, but that's the way that we would be screening our patients for malnutrition. So to score those questions, for question 1, has the patient lost weight without trying? No gets a 0. If they're unsure, if they haven't been weighed, they get 2 points. And if they have lost weight, then there's different scores for the different weights that they might have lost, 1, 2, 3, 4. And then for the next question, it's just a yes or a no, with a 0 for a no and a 1 for a yes.
Thank you.
So I guess the idea with screening, if the patient gets a score of 2 or more, then they would need to be referred to me, the dietitian, for a full assessment. So it's up to you guys to do the screening, but then it's up to us to do the actual assessment to figure out what to do next. Yeah. Any questions about that?
How long does it usually take you to get here?
It depends. Usually I can get here straight away.
Oh, okay.
Yeah.
So not like a week or...
No, if it's a malnutrition referral, I'm meant to be here within 48 hours.
Okay.
Yeah, I guess that's mandated in the nutrition care policy. But that's like within 48 hours if it's working days or whatever. Any other questions about the MSD? No. So we might practice ways of using this tool with our patients. For the first question, how do you think you would go about filling in that question? Any comments?
I suppose you look at their notes.
Yeah.
We weigh them monthly.
Yeah.
So
So
Sometimes ask them or ask their
I'll
family
go.
members to.
Yeah, that's right. If they're a new resident, maybe they haven't been weighed yet, so you need to get some history from the patient or their family. Yeah. Any other ways we could ask that question? I suppose it explains a bit on this form here, like the patient might have no idea whether they've actually lost weight or not, so you might ask them, are your clothes fitting you any differently? Are they a bit baggier or are they a bit tighter? Things like that, that might make more sense to the patient than have you lost weight recently. And you might suspect it as well by looking at the patient, whether they look visibly skinnier, but often you can't tell by looking at somebody whether they've lost weight or not until it's too late and they've lost 10, 20 kilos. By then we should have picked it up much earlier. How about the second question? How do you think you could assess that one?
well, it's hard with dementia patients, but we hear for like these girls always feed the ones that can't feed themselves anyway,
Yeah.
so they've got a fair idea of how much they're eating,
That's right.
And sometimes the kitchen will
Sometimes
make
you
a
can see
comment,
it anyway.
but if someone
what's
hasn't.
going on.
Exactly. That's right. If the patient's unable to verbalise it, then I guess we've just got to pay more attention to how much they're eating and what gets left on their plate. Yeah. And I guess that comes down to the next thing, whether the food that they're getting is appropriate or whether they're getting assistance to eat if they need it or not. So on that form, you would record the scores and then add up the total. And then if it's more than 2, which is pretty easy to get more than a score of 2, straight up if they're unsure about their weight, they would get a score of 2 and then get a referral to see the dietitian. So maybe they might have lost 1 to 5 kilos and have a decreased appetite, so that's a score of 2 as well. So I guess the tool's pretty sensitive at picking this up, but it's just picking up people that are